Well, thank you, Bill, for that very, very generous introduction, and good afternoon, everyone, both here in our auditorium at the National Academy of Sciences and those listening in on the webcast. It's a pleasure to welcome you at this inaugural forum for our new roundtable on obesity solutions. Solutions is really, to me, the key word. We all know what the problem is. We know how important the problem has been. The Institute of Medicine, as Bill alluded, has produced more than a dozen reports and workshop summaries on different aspects of the obesity problem. Obesity in children, dealing with the problem in families, looking at ways that we can utilize community resources to influence and affect and reduce childhood and adult obesity, examining the evidence about the prevention of obesity, looking at ways government at all levels, including particularly local government, can effect change for preventing obesity. And in all of this work, the Institute of Medicine repeatedly has laid out ideas, described solutions, described ways that we could together as a community, as leaders, as individuals, make a difference against obesity. What's so exciting to me about the advent of this new roundtable is that the roundtable brings together leaders from all sectors, from government, from industry, from academia in many different venues, from consumer organizations, and representatives of the public at large, all dedicated to the same basic proposition that we, working together, can reduce obesity in the United States. And in fact, what's so timely about this new roundtable is that there is beginning evidence of some positive trends, some hints that solutions are really possible. From the pediatric nutrition surveillance system, we learn that from 2008 to 2011, there were significant downward trends in the levels of obesity prevalence among low-income preschoolers. These occurred in 18 states and in the Virgin Islands. Now, low-income preschoolers are not the entire population. 18 states are not 50 states. But change is beginning, and change in a positive direction is taking place. The challenge for all of us in this country, and particularly the tasks set before this roundtable, is how do we, working together, manage to accelerate this progress? How do we make the decline of obesity not the exception and the exciting hint of the future, but the norm and the mainstream of the future? What do we need to do? Part of what I hope the new roundtable will take up are what we call a set of action innovation collaboratives. These are ways in which the leaders working together and mobilizing others can focus on particular aspects of the problem, design solutions, and bring those into effect. We can work on aspects like physical activity, especially among young people. We can amplify the work that so many others are trying to do in this field. We can look at the special challenges of early education and early care in childhood. We can look at the food system and the ways that it can be more healthful. We can examine for individuals and communities practical applications of prevention. We can look at better measures and indicators of progress in communities, in states, in the nation as a whole. The Institute of Medicine brings together the best expertise, the most thoughtful people to try to set forth solutions to the health challenges of our nation. There's no problem that more readily exemplifies both the challenge and the potential for solution than obesity in the United States. I'm very excited at the advent of this work. I believe it has the potential to make a material and substantial contribution to the solution. I salute all the members of the Roundtable, and particularly our chair and vice chairs for their work, and I am very grateful to Lynn and all of our staff at the Food and Nutrition Board who are supporting the work, and especially delighted at all of you who are here today to participate and contribute to the ongoing solutions to the obesity challenge. Thank you all very, very much.
In addition to our director, Lynn Parker, and the staff that Dr. Fineberg just referenced, we have, I think, been very lucky to obtain the additional assistance for this work of someone well known, not just in the field, but also here at the Institute. Bill Dietz is our consultant. He is a former director of the Division of Nutrition, Physical Activity, and Obesity at the CDC, served as a professor at Tufts. He's worked at the state and local and other levels throughout this country, been involved both in the national level within our government, but also in all of the professional associations with which we would hope he would have experience. He's written widely in all of the areas of concern here. He is, most importantly, a member of the Institute of Medicine and a consultant for the life of this roundtable, Dr. Bill Dietz.